Blood thinner medications are a part of life for many heart patients, and this morning our daytime Tri-Cities cardiology specialist, Dr. Shoba, is here to help us understand a bit more about these life-saving medications. Blood thinners, I mean, I know several people that take different variations of them, and there are many variations of them out there.
Right, and it's very important for each of us to recognize why we are on the blood thinner and what the medication does to them as far as side effects and what they need to watch for.
Right.
And it is the why you're on the blood thinner that determines which kind of blood thinner that you take. Just a simple explanation, you know, our blood has got two big components. One is the liquid part of the blood with all the clotting factors in it, and one is the blood cells part of it. Those are called platelets.
Right.
So some medications like aspirin work on the platelets. Some medications like the older drug Coumadin and the newer drugs that you see on TV, all these ads, you know, the Pradaxa, the Xarelto and all that, they all work on the liquid part of the blood. And so, for example, let's take a few examples. You're on a long travel, you get a clot in the leg. The blood is kind of stagnating in your legs. The aspirin is not going to prevent the clot. Or if you have a blood clot to the lung, you need to have the ones that work on the liquid part of the blood, like the warfarin or the newer blood thinners. Now, if you have a heart attack, that is initially because of the blood cells, the platelets that go and get stuck in the arteries of your heart, and then the clot forms. So for those people, you need medications like aspirin. If you've had a new stent put in, we give medications like aspirin, Plavix, clopidogrel, ticagrelor, Brilinta, prasugrel, Effient. Those all work on the platelets.
Right.
So even if you're on warfarin, you would still need some of those to keep your stent open. And so there's a lot of issues and concerns that patients have. You know, I'm taking you know, you have a condition called atrial fibrillation, one of the biggies that causes stroke.
We hear a lot about that, yes.
Correct. You know, your aspirin and Plavix is not strong enough to prevent the strokes. Here, the blood is pretty much sitting in the upper chamber of the heart. The heart doesn't contract properly. The blood is just sitting there. Plus, there's a lot of inflammation going on. You've got congestive heart failure, you've got diabetes, you've got high blood pressure. So you've got an inflammation component, and the blood is just sitting there. So it's in the liquid part of the blood. So you want to get rid of the clotting factors in the liquid part of the blood. So you need to be on medications like warfarin, the Xarelto, the Pradaxa, the Dabigat, you know, one of the newer agents. So, you know, why, suppose you have a hole in the heart. You know, a lot of us are born, all of us are born with a hole in the heart. And then over time, it closes. But what they've found is in people who have strokes and have this little hole, you're better off taking the blood thinners that work on the liquid part of the blood. The aspirin is not enough. And so people will say, oh, I cut my, you know, I bruise so easily when I shave, and so if I've got AFib, but I'm not going to take any blood thinners because well, the aspirin works in a different way. It may not prevent the stroke. So, you know, there is a reason why your doctor gives you the stronger blood thinners. Of course, with the stronger blood thinner comes the risk of bleed, you know, and the most common source of bleed is your intestine. So if you see any dark stools, you need to be very careful. You could be bleeding in there. Now, if you're on blood thinners, you need to be very careful. If you take ibuprofen or, you know, those kind of medications, it can tear the lining of your stomach and you can bleed more. If you've got polyps or cancer or somewhere in your gut, you will bleed more. So if you've got an underlying problem that can make you bleed, then these blood thinners can make you bleed. So you have to be very careful. Just one word of caution to our people, because, you know, all of them take these natural products for blood thinning. There's ginger, there's garlic, there's hawthorn berry, there's ginkgo biloba, there's the bromeliads, there's a whole bunch of fish oils. A lot of them can thin the blood, but unfortunately none of them have been proven to prevent strokes or blood clots in the legs or heart attacks. You know, you cannot do studies on such agents, you know, when there are proven drugs. And so so when patients stop their blood thinner medications and put themselves on all these natural products, you know, you're still exposing yourself to stroke.
And really quickly, if you're taking those herbal supplements and things of that nature, you better make sure with your doctor that it's going to go well with any other medications.
Absolutely. And if you take some antibiotics and you're taking warfarin, then, you know, your risk of bleeding becomes higher because the blood becomes thinner. All right.
Dr. Shoba, so much information. We could sit here and talk for another half an hour about it. Thank you so much. Check out the website right there if you have any questions at heart.org.